Hello everyone. In this lecture, we look at inflammation and how we can treat inflammation by using different types of anti-inflammatories. Special thanks go to Dr. Sarah for these wonderful slides, and I hope you enjoy this lecture today. Okay, before we proceed, I would like you to refresh your memory on inflammation by looking at these questions. So, question number one, what diseases can you think of that involve inflammation? It could be your personal experience, or it could be from your family members or from your friends. Anyway, these are some examples. Well, you have got asthma, which is basically an allergic response, or we call it hypersensitivity. Gastric ulcer, that's commonly caused by bacterial infection. Eczema, it is a type of skin allergy. Ulcerative colitis, which is the inflammation of your digestive tract. Arthritis and multiple sclerosis, which involves um, what we call the autoimmune disease, by which your immune cells are attacking your own cells and tissues. So, what can be the trigger of inflammation? Again, just some examples. In the case of asthma and some allergic conditions, then you have got allergens. You also got infection, such as H. pylori, that can be the top causative agent of gastric ulcer. Skin wounding, radiation, heat, these are all physical factors that can lead into inflammation. And last but not least, food poisoning that can lead to the inflammation of your digestive tract. Okay, question number three. How have you personally experienced inflammation? Well, it's your own story. These are just some examples again. It could be asthma attack, hay fever, hives, bee sting, mosquito bite, anaphylaxis. Basically, these are all allergic conditions. While sunburn, it is just physical, which could be caused by heat and UV radiation, or also in some scenarios, it could be chemical burn. So question number four, what does inflammation look like or feel like? Okay, these are the symptoms. Of course, you will feel the pain, the heat, the redness, numbness. Of course, it's going to be swelling a lot, and some pressure will build up due to the accumulation of fluid around the inflamed area. Question number five, what cells and systems are involved in the inflammatory responses? Okay, you've got the lymph nodes, which filter out your lymph to clear off bacteria and microorganisms. Macrophages, which is basically a cell that engulf foreign bodies. Spleen, that filter out your blood to screen and to remove any microorganisms. White blood cells, you should know what they do. And mast cells, which is a cell type that specifically produce histamine that is important in causing the allergic responses. And last but not least, what anti-inflammatory drugs do you already recognize? Again, these are just some examples. Corticosteroids, diclofenac, naproxen, ibuprofen, aspirin, and many more. And these are the learning outcomes for this lecture. Number one, you must be able to discuss and compare differences in between inflammatory responses and the immune responses. Number two, you need to know and identify the key inflammatory mediators or the chemicals involved in inflammation. Number three, to be able to identify and describe four major classes of anti-inflammatory drugs and their applications. So, what is the purpose of inflammation? We often see inflammation as something negative because it is associated with pain and swelling. But in fact, inflammation is a defensive tool to fight against infection. And showing here are the three major roles of inflammation. First, it helps to restrict damage and to stop pathogen from moving around to other parts of our body. Secondly, it helps to remove the pathogen along with the damaged tissues, mostly through the action of phagocytosis. And eventually, inflammation facilitates the repair and regeneration of the damaged tissues. So here is when you will get a scar, as scarring is the final phase of healing, when your damaged tissue is replaced with collagen. Okay, these are the classical signs of inflammation. You have got rubor, tumor, calor, and dollar. So what is rubor? Well, it sounds like a ruby, which is red in color. So it simply means redness, or in the medical term, we call it erythema, and it is caused by an increased blood supply to the inflamed area. What is tumor? It is swelling caused by the infiltration of white blood cells and plasma into the inflamed area. And what is calor? Calorie, it means heat. So in inflammation, you get to feel the extra heat because of the transfer of your body heat to the damaged area by the increased blood supply. And what is dollar? Well, it has nothing to do with money, but without money, you are in pain. So dollar means a painful sensation due to the sensitization of your nociceptor. So it is a sensory neuron activated by prostaglandin that is released during inflammation. So to summarize, these are what you will experience during inflammation. You got redness, swelling, heat, and pain. And when a full recovery is not possible, it will lead into the fifth sign, which is the loss of function, such as how your skin could lose its hair follicle and sweat gland after a major trauma. Okay, here is a quick recap to what you have learned in immunology. There are two types of immune responses, namely the innate immune response and the adaptive immune response. Which one do you think inflammation belongs to? Well, it fits better in the innate immune response. But why do I say so? That's because inflammation, like the innate response, is an immediate response to injury. So it almost happens instantaneously. And sometimes we call it the non-specific immune response because it will kill just everything that's foreign or alien to the body by phagocytosis, and it has no memory component, meaning that it will not recognize or remember the same pathogen next time. Now, on the other hand, the adaptive immune response is specific and it has the memory component. So it is specific because it remembers a specific antigen and it will only kill the same target next time. So for the adaptive response to occur, you'll first need the innate response to capture the pathogen so that you could then present the antigen on the MHC of your antigen presenting cells. So what is MHC? It stands for the major histocompatibility complex, which is a surface protein. So with the antigen presented on your MHC, it is then only possible to stimulate your T cells and B cells to initiate the adaptive response. So I would say that the immune response is pretty much like a heavy machine gunner who shoots at everyone that comes in, while the adaptive immune response is more like a sniper who only kills specific targets with the information given to him. So for more information, you could refer to Dr. Ronnie's lecture. Okay, macrophages are essential to the innate response because they express many types of receptors. In other words, they can respond and bind to many types of pathogens or foreign bodies. Mannose receptor and glucan receptor, for example, can bind to glycoproteins on the surface of pathogens, while LPS receptor, it stands for lipopolysaccharide. So where can you find lipopolysaccharide? Is it gram-positive or gram-negative bacteria? Well, they are found on the surface of the gram-negative bacteria, which in other words, it is an attachment site for targeting the gram-negative bacteria. And you also have the scavenger receptor that scavenge and remove damaged cell components from the bloodstream. For the TLR number 2, it stands for toll-like receptor number 2. It can bind to many types of pathogens, and toll-like receptor number 4, on the other hand, can interact with the antigen presented on lymphocyte, speeding up the immune responses. So the question is, where can you find macrophages? And the answer is very simple. It is essentially everywhere. It can be found in your skin, in your lung, in your spleen, in your bone, and etc. And that's because when there is an invasion, macrophages will be there to fight against infection. So it must be everywhere and to be ready to engulf the pathogen, then releasing chemical messengers such as chemokines and cytokines. They are important in the cell signaling of immune responses. And what are the responses? You will get vasodilation, which means you will get increased permeability of your capillaries. And with that, you attract all kinds of inflammatory cells, such as neutrophils, to migrate into the tissues. Then you will get the release of inflammatory mediators that can cause pain. And to summarize, we can say that macrophages initiate inflammation. And again, for more information, please refer to Dr. Ronnie's lecture. So, what happens during inflammation? The first thing to happen is microvascular events. This includes vasodilation and increased permeability that happens pretty much immediately, and it could last up to 12 hours. While when that is going on, you have the release of chemical mediators as a form of communication in between different cell types. So this process is going on from the very beginning of the inflammation until the end of inflammation. So with the increased permeability and the release of chemical mediators, white blood cells are attracted to the site of injury, and they can then cross the capillary membrane into the tissue, causing cell accumulation. So it takes about 6 hours for this to happen, and it can sustain up to 5 days. And sometimes, if the infection is not contained by these mechanisms, some pathogen can get into the lymphatic system and eventually into your circulatory system, giving you the systemic effects. So this condition of systemic infection is known as sepsis. If you have a bacterial infection, it's called bacteremia. When you have a viral infection, that is called viremia. And in both cases, you will need very strong doses of antibiotics or antiviral drugs injected through your veins. It is not until day 4 or day 5 your tissue will start to heal, as you need time to clear the pathogen and the damaged tissues from your body. So aside from the macrophage that we have just mentioned, another important player in local inflammation is the mast cell. So from this electromicrogram, you can see that they are plentiful of purplish granules, which is basically granules containing histamine and some other cytokines. So when the mast cell is triggered by tissue damage, they degranulate and release these chemicals. And when this happens, it is called mast cell activation. So when mast cell activation happens in your GI tract, it increases fluid secretion and peristalsis, which leads to diarrhea and vomiting. So this is one example of your ulcerative colitis. And when it happens in your airways, it increases mucus secretion and causes bronchoconstriction, leading to blockade of your airways, which is associated with symptoms like coughing, wheezing, and so on. And if it happens in your blood vessels, it causes, again, vasodilation and increased permeability as mentioned before. But how is inflammation initiated? Well, it always begins with tissue injury, with or without infection. In other words, you can get an internal inflammation without infection, such as bruising yourself by a hit or by a punch, because the ultimate trigger here for inflammation is tissue damage. Then it is followed by the production of inflammatory mediators, which are the chemicals released by your mast cells and the macrophages. And there are two types of inflammatory mediators, which are the vasoactive mediators that can cause increased permeability and edema, and the chemotactic factors that attract and stimulate inflammatory cells. So what do you get as a result? It is either a rapid onset of acute inflammation or a long-term inflammation. We call it chronic inflammation. Okay, I will not go through all these mediators and factors one by one. It is your homework to find out the basic function of these chemicals. And next, let's talk about how do we resolve inflammation. So when you have an inflamed tissue, you will get more of the white blood cells infiltration due to increased permeability of your capillary membrane. And you also get the release of more cytokine and chemokines that we have discussed just now. As a result, you will get all these classic symptoms of inflammation, which are rubor, tuber, dollar, and Keller. But don't forget that the purpose of having inflammation is to first remove the pathogen from a body, and then second, for recovery. So to stop inflammation, lipocortin will be released by immune cells. So lipocortin is also known as annexin A1, and it has inhibitory effect towards the enzyme phospholipase A2, which is an enzyme that is needed for the production of many inflammatory mediators such as prostaglandin. So with lipocortin, inflammation is stopped. And you can proceed with the removal of fibrin that stops bleeding. So remember, you convert fibrinogen into fibrin to stop bleeding. So it will now be replaced with healthy tissue. So if you get a full recovery, there will be no scarring and the function is restored. And that depends on the severity of the injury, because sometimes you cannot remove all the fibrin, and a certain part of it will be replaced by collagen, which is a structural protein. With that, it will result in tissue scarring and a loss of function, such as your hair follicle. You have learned that for inflammation to occur, you will need several inflammatory mediators, such as prostaglandin and leukotriene, and they all belong to this class of chemical known as the eicosanoids. So what is eicosanoids? Well, an icosahedron is a structure with 20 phases. And likewise, an eicosanoid is a molecule that comes in 20 carbons. For example, arachidonic acid has 20 carbons, and it is the precursor molecule to make all these inflammatory mediators, such as the prostaglandins, thromboxanes, and the leukotrienes. While the precursor for arachidonic acid is a very popular molecule because it is derived directly from your phospholipids, which is in your cell membrane. So what is the trigger of the production of eicosanoids? The answer is trauma and infection, which stimulates phagocytosis and mast cell degranulation. And for this reaction to happen, we will need the enzyme phospholipase A2. Remember in the previous slide, I mentioned that annexin A1 is the inhibitor for this enzyme. So just for your information, the platelet activating factor PAF is also a family of this phospholipase A2. And what is the function of PAF? It is required in the aggregation of platelet cells. You have learned that in my physiology lecture. And now let's look at eicosanoids with more details. We will look at the prostanoids, which is a class of eicosanoids that forms prostacyclin. So for your information, prostacyclin is actually a type of prostaglandin. And to make prostacyclin, we will need the enzyme cyclooxygenase or the COX enzyme to convert arachidonic acid into an intermediate prostaglandin PGH2 that is unstable, and it does so by adding extra oxygen atoms. So here comes the name oxygenase because it added two extra oxygen atoms. Then we need a second enzyme, which is a peroxidase, to convert the intermediate prostaglandin PGH2 into the final product, prostacyclin or PGI2. So prostacyclin is an inflammatory mediator that dilates your blood vessels. So it is a vasodilator, and it is also hyperalgesic, meaning that it increases your sensitivity towards pain and it stops platelet aggregation. On the other hand, the very same intermediate prostaglandin can be converted into thromboxane A2, TXA2, which has the opposite effects, such as thrombotic effect, meaning that it promotes platelet aggregation, and also vasoconstriction. And again, the enzyme needed for this process is a peroxidase, specifically the cyclic endoperoxidases. They will convert the intermediate product to either PGI2 or TXA2. Now, here comes the question. Why do we need both prostacyclin and thromboxane A2 if their effects basically cancel out one another? Well, here is the answer. Because we need them to achieve a balance in homeostatic as well as hemostatic interaction. So it's like how you need both the brake pedal and the accelerator in driving to strike a balance. Okay, another example of icosanoid is leukotrienes. Looking at the name, leuko means they are produced by the white blood cells and it has three conjugated double bonds. So this is how a common leukotriene looks like. And my question is, what is the precursor of leukotriene? Well, the answer is again the 20-carbon arachidonic acid. With the action from 12-lipoxygenase, we can convert arachidonic acid into 12-HBETE, which is subsequently converted into 12-HETE. And that is what makes you itchy along with histamine. And now with another enzyme, the 5-lipoxygenase, you can convert arachidonic acid into 5-HBETE and eventually leukotriene A4. So it serves as a precursor molecule to make leukotriene B4 under the action of the enzyme hydrolase. Well, with another enzyme, glutathione S transferase, you can make another type of leukotriene, which is LTC4, and it is also a precursor to many other types of leukotrienes. So from here, it's very obvious that by inhibiting 5-lipoxygenase, we can block the production of many leukotrienes, which explains why it is a preferred pathway in the making of drugs.